All right, good morning. I have 9:02. It is Monday, May 18th. Thank you guys very much for being on the call. We have a very special guest this morning. Miss Ginette Velez from Devoted will be speaking about some updates and cool things that you need to know about Devoted Healthcare. But before we do that, I'm going to jump right in and we're going to talk about what's going on this week at Health Plan Markets and everything in the industry. So first off, we are opening the office this week starting tomorrow, and it's going to be kind of business as usual. We are not opening up to the general public for those folks that are looking for health insurance, walk-in traffic. We're going to minimize that. However, we're going to be open for you, the agents, our partners. So if you need to come into the office to grab supplies, kits, and things like that, feel free to do so starting tomorrow. And we will have normal business hours this week is going to be Tuesday through Friday, 9 a.m. to 6 p.m. And then we'll go back to normal next week, Monday through Friday, 9 to 6. So kind of gearing back into things. However, again, we're not going to be open to the general public, and that's just to minimize the risk of exposure, obviously. And however, if you are in the area and you want to have a client meeting at the office, we can arrange for that either on one of the days that we're not there or after hours, again, just to minimize exposure to the staff and to yourself and all that good stuff. So those are our office hours. I will be sending out a text message as well just to keep you up to date on that. I apologize for the rough voice. I am battling bronchitis, so I get that once a year. Those of you that have known me for a while know that I go through this pretty much once a year. So a little rough on the voice today, so I apologize. Training calendar. We do have a training calendar up and running on our website. I've been sending out the links to that. Check your emails for trainings. Most of the trainings, as you know, are online. Please make sure you identify which trainings are going to help you the most. Right now, I think online enrollment is a very hot topic. And specifically with Devoted, they have an incredible enrollment tool online, very, very easy to use. I've used it myself, and even the electronic scope of appointment. So, if you're unfamiliar with these electronic enrollment platforms, please make sure that you spend some time, put that in your calendar, and make sure that you go out there and you learn how to do e-apps. This is not going to be just a flash in the pan. This is going to be a trend from now on, and I do believe that those agents that learn these e-apps are just going to have a leg up on everything as we move forward through this business. So check that training calendar. Make sure that you're getting out there and learning all this great information on this new way of doing business. And again, as I've been talking every week, really you should be thinking yourself as a hybrid agent. I believe that we're still going to be out there. Once everything clears up, we're still going to be out there marketing and meeting people and sitting down with them to discuss their health insurance options. But I do believe that being a hybrid agent, meaning that now you'll know how to do remote applications and remote presentations and do that full enrollment piece, that's going to be critical to your business. So please make sure that you spend some time and learn those e-apps if you're not familiar with it. We do have an electronic consent to contact form, and that is available. You can get that set up. All you have to do is email John Minotti, send us a message, and we'll make sure to take care of that for you. Our e-app collection basically is a lead gathering system. So that way you can go in and track which leads that you have. So if somebody calls you, you can plug in all their information, and it's a consent to contact. You can send them the link. They can fill it out, and then it saves it in a spreadsheet, which makes it already ready to mail, email, text message, whatever you got to do. You can collect that information, and it all lives in one place, all organized for you. So if you don't have that set up for yourself, please let us know, and we will get somebody on it to help you with that. We also have a list service. So if you're looking for a list to market to, please let us know, and we'll be glad to help them with any list services that are available. Now, one quick trick that I wanted to share with you guys this weekend, I was texting somebody that was bilingual, and it seemed to me that they were a little bit more comfortable speaking in Spanish. So I found out that Google has a translate button that you can use on your text message services. So I'm going to do a little training later on, but look at that because Google does have a great translate button in the text app. So with that, that's pretty much all I have. I'm going to go ahead and pass it over to Ginette. So bear with me, Ginette. I'm going to take you off mute, and I'll let you have it. So hold on one second. And there you are.
Hi, Justin. Good morning,
Good morning.
HPM team. Thank you for having me. First, I want to make sure that I let everyone know that I hope that you are staying safe in this time. And by this time, we already know how to protect ourselves, right? So I know that some of us are going out slowly, little by little, but I hope you're all staying safe. Second, I miss HPM. I miss my role and being a support person for my agents. So I'm now with Devoted Health, and I just wanted to let you know that I'm here for you. And we really have some exciting news going forward. We are going to be moving into Orange County for the annual enrollment period, as well as Lake County. If you don't know about Devoted Health, get to know Devoted Health. Call me. I will tell you all about it. This is our third year coming into the market, but we are here to stay. We're not looking to sell our organization. And I believe that we are going to be competing with the major plans in the area. We already do. We're looking forward to our conversations with Advent Health upcoming this week. So wish us luck with that. We are trying to get the Advent Health contract, and I'm almost positive that it's going to go well for us. So we're also opening up that's going to open up networks for us, especially Orange County. And we are looking to contract with other larger MSOs in the area. So we are pushing forward, even though we have this COVID-19, for a AEP, a normal AEP. We don't know what that's going to look like, but we're being positive. We're just moving forward with all of our plans. For you as an agent, I will tell you that I was a broker for AEP, and I sold all of the plans, and I sold Devoted. And one of the things that impressed me about Devoted Health was the ease of using the application itself and just dealing with the organization. So as opposed to some other plans where you had to have several different platforms and things like this. So the platform is super easy if you haven't used it. Everything is done from our Devoted Health website. You don't have to go to, 2 or 3 different platforms. You can use our scope of appointment via electronic scope of appointment, where you simply open it up and you email it to the client, and they fill it out and send it, and it goes back to you automatically, or you can do a 3-way call with the organization. The electronic app is very simple. Even prior to COVID-19, the member did not have to sign the application, basically complete it, and submit it. Once you submit the application, then Devoted Health will reach out to you, your member, and confirm the enrollment. We have very competitive benefits right now. We have a money-back plan of $125. You don't have to have a chronic condition. I know most of you here work in Orange, but we have our plans are in Seminole and Osceola. And we have a 20 an LIS plan for people that have LIS. It's all zero copays except for hospitalization in special skilled nursing facility, and we also have a core plan. So our benefits are extremely competitive. We have a personal response system that goes around their neck. We have over-the-counter benefits. We give them quarterly Visa cards of $25 every time they go to the primary care doctor. Their over-the-counter is picked up at the CVS. And our member guides are one of the most important benefits that we have. And one of our strongest assets is the member services. So we're scaling that up. It can be scaled up for any growth that we have, and we're still answering our calls within 30 seconds. So your members will be extremely happy, and that's going to be something that's important to you. So I think that's it for now. People are hanging up. I guess I'm talking too much. But thank you, Justin.
No, they're
appreciate
joining. Yeah.
it.
So question for you: if you were to, tell an agent, one plan that they should really look at from Devoted, which one would it be?
One plan right now, I guess, if you're looking at a special election period, it's our Prime plan. Our Prime plan is an LIS plan. It's very versatile. It has a monthly premium, and if they don't have any assistance, they have a monthly premium, 0 copays. If they have LIS will pick up that premium. They'll still have 0 copays. And if they have Medicaid, full or partial, they can have that plan with 0 copays as well. And then if they're partial, they'll have some copays. So it's very versatile.
Yeah, and if I can add to that, I know that, Jimmy had taught me this trick last year. For those folks that are kind of more, comfortable buying a plan and having to pay a premium, it's almost like a supplement alternative in a way.
Right.
And he was actually saying that, if you have supplement customers, talk to them. It's possible that they might be a little bit more comfortable buying a plan, even though it's a low premium. They just feel better buying something. Are you still finding that?
Yeah, it is a good alternative, and that's basically for higher incomes or people that, maybe can't afford the $28 and just don't want to pay any copays. They don't want to pay any hospitalization copays, so they want to have assurance that they're going to have all zeros, once they pay that small premium, which is just $28. So, yeah.
Awesome. So you and I are putting together some things for AEP. Do you have any thoughts on what agents should be doing when they're looking at Devoted for this year in AEP? I know everything's kind of up in the air, but any thoughts or ideas on what they should be doing for marketing?
Well, the organization is doing a lot of marketing right now. There's probably going to be, I'm hoping, some television this year, because last year we weren't in orange, so the advertising was spilling into, we couldn't do the TV spilling into because it would have spilled into orange, but now that we have a Seminole Orange, if people will know about us, there's going to be a lot more brand recognition. Basically, I know that we have 4 options, right? We have the Humana, Care Plus, Freedom, and WellCare basically in this area, right? I mean, we compete with United, but United has, the PPO. So if you're looking at apples to apples or oranges, we basically compete in the space with all of those plans, especially once we get the Advent Health product hospital here. I do recommend that you guys just get appointed. Get appointed as soon as you can. It is one of the easiest certifications that you can do. It's very simple. You'll notice that the book is very clean. The platform is very simple, so it's a refreshing plan to offer, if I can say. And like I said, I sold all of them this year, and it was one of the easiest platforms. Your client will be super happy, and it's just get to know the product. There's only 3 products. It's very simple and easy. The products are simple. It's just we have a lot of different things that other plans don't have. So we're very unique. And just because we're new doesn't mean that we don't know what we're doing. We know what we're doing. We're new. This is our 3rd year, and we're coming into the market pretty aggressively, and I feel very confident that we're going to do well this year. So definitely get appointed if you're going to do anything.
Yeah, and to do that, guys, just
Yeah.
send us an email or text. Jessica at the office, if you bump into her or talk to her, let her know that you're interested in the Devoted contract, and we'll send that out to you ASAP. If you want to text me, I'll do it for you, no problem. Most of you have my cell phone number, or shoot me an email, and we'll get you set up with Devoted. But Ginette makes a great point, because as of next month, rumor has it that AHIP's going to be released a little bit early. And, if you get your contracting done now, you don't have to scramble in the busiest time of year to worry about contracting and then certifying. If you get your contract in now, then you can certify, so you're already one step ahead. So if you don't have Devoted right now, I would highly, highly recommend that you do that. So you are expanding in Orange County. Is there any other counties that they should be aware of as far as expansion for 2021?
We're going to be in Lake County as well.
Mm-hmm.
We did hire another manager for the villages, not just the villages, but also the surrounding areas of Lake County. So we're moving in there. We are going into, I believe it's Pasco, Pinellas counties as well. But right now we're not in Volusia, so we don't have anything in there yet. Or in Osceola, Seminole, not in Brevard yet. But, so we're simply just going into the competitive markets at the moment. And you will be very happy with the service. And I had an opportunity to work for other plans, but I chose this one because I was super, super impressed on the way they handle their members, the communication that the company has with their members. We text our members, we call our members, and the communication and the digital operations within the company is really phenomenal. The referrals are done automatically. Mm-hmm. Your authorizations are done within 3 days, and the providers get paid within 5 days. And you guys get paid on time, and it's correct.
We like that.
So, yes. So, yeah.
Yeah, and I can attest to that. I have had zero issues with commissions for Devoted on the agent side or the agency side, so I do commend them for doing such a great job on commissions. It's not an easy thing to accomplish, so that's fantastic. So one last question for you. As far as marketing, we have some agents that are presenters, and they're concerned that, number one, if they do seminars, is anyone going to show up? And number two, are they safe to do seminars in the fall? So do you have any plans on doing anything as far as web seminars for the agents, or an opportunity to do that for some of our presenters?
Yes and yes. So the first yes would be our normal life seminars. Mm-hmm. Seminars don't work for plans that don't advertise them. Right. So we are advertising. We are giving a $10 gift card, but the key to the way we do it is that we give them a BRC to complete. And that is basically, we give them a card to complete to get the gift card returned to them. And there's a little checkbox so it says, yes, have an agent call me, or no. Typically, they're checking that, especially during AEP. So in this seminar, you will not only collect the cards for them to get their $10 gift card, but you'll also keep those leads that say yes. So it's just a great way of doing a seminar. It's not, okay, we're going to give you a $10 gift card and then you leave and I don't have any contact information for you. Right. One of the reasons why I was able to sell 27 Devoted plans in AEP is because I was able to follow up on all those leads from our seminar. So we are offering seminars to brokers that are interested in doing it, we want. It's super easy to sell, but we just want to make sure that you're competent in your presenting, which I'm sure you have a lot of great presenters, Justin, And then for virtual, so there is opportunity to do seminars. I've already put the schedule together. I'm just trying to find out what venues are going to allow us to do it, and or if we're even going to be able to do seminars. But like I said, we're moving forward. The alternative is the virtual seminars. Currently, we have a 101 devoted Medicare 101 that you can use if you need it, and we're also working on doing a virtual presentation for AP. So we are working on all of that. We have a plan A and we have a plan B. So
outstanding.
Yeah, you can do. If you're interested in doing a seminar, please let me know so that we can plug you in. Because so right now we're moving forward with normalcy, and then also I'm sure there will be something available for you guys to use virtually.
Awesome. So, guys, if you are interested in being a presenter, whether a live presenter or you're interested in doing web seminars, we've only had a few requests. So if you haven't put in your request, now's the time to do it, because we will be sending out invites for how to do a virtual seminar, and we're going to have different tools that you guys can use. And we're going to connect with Ginette on what Devoted expects from us and from you guys as far as presenters go. And we'll put that together so you're ready and confident for AEP, whether you do a live seminar or a virtual seminar. So stay tuned on that, but please let us know if you're interested, because that is important.
Yes, and my phone number is still the same. So if you guys have my old phone number, it's still the same. Please do not hesitate to reach out to me if you need. I've sat with a couple of you already on a Google Hangouts meet, and I went over personal one-on-one training with you, which should take a few minutes. The nice thing about Devoted platform is if you're going to do get in the application electronically, basically it's your NPN number and the last 4 of your social. So you can't forget those 2 things to log in. So that's super, super simple. You'll go into Miramar Agent and log in to get certification, and then it'll take about 5 days for the state to appoint you. But the test is so easy. So, if you need help, please call me. Don't hesitate to call me. I have nothing but time right now to help you. So I'm more than happy to get on a Google Hangouts meeting and give you a little training.
I appreciate that. And just for those folks that may have misplaced your number or are new, could you share your phone number for us?
Yes. Number is 407-430-5322. That's 407-430-5322.
Thank you. All right, guys, I'm going to open it up for questions. So if you have questions for Ginette or myself, please. Any questions this morning? No one had their coffee. All right, guys, if there's no questions, I want to thank everyone for being on the call. Ginette, thank you very much for spending time with us this morning and giving us the update on Devoted. We really appreciate it. I do highly recommend that you guys check out Devoted. They are hot, 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 and it's only going to get better for next year. So if you don't have that one added to your portfolio, please let us know, and we will get you set up. All right, I hope everyone has a fantastic week. We are here for you. Please give us a call if you need help. Thanks again, and have a great week.
Thank you. Thank you, Dustin. Appreciate it. Have a great day, guys. Okay.
You too.
All right, take care.